Hi everyone, today we will discuss ophthalmology BCQs. So let's get started. Now, before getting started, the page you are seeing right now, there are a number on the left side and there is a subject from where the question belongs. Now, the question is prudent discharge occurs in which form of the conjunctivitis? There are a bunch of the options of conjunctivitis. So, we will dissect options one by one and we'll find out by the process of elimination that which option is right. So first option is your vernal conjunctivitis. The characteristic exudate of vernal conjunctivitis is mucoid and it is sticky. There are ropey secretions. So the option A, vernal conjunctivitis, is clearly wrong. Now, option B is your fungal infection, which is a tricky option because in fungal infection, prudent and as well as mucoprudent discharge occurs. But because it is not truly prudent, uh, we just eliminate this option. Now, moving on to the option number C, that is your allergic inflammation of conjunctiva, which is just a fancy way of saying allergic conjunctivitis. And in allergic conjunctivitis, the discharge is watery and it is also associated with your sneezing and nasal discharge. Moving on to the option number D, that is your acute viral conjunctivitis. In acute viral conjunctivitis, there is a watery discharge, and the most common cause of this is your adenovirus. Now, moving on to the option E, which is your severe acute bacterial conjunctivitis. In this this conjunctivitis is caused by your gonococci, and here purulent discharge occurs. So the correct option is your option number E. Now, moving on to the second question, that is from the pharmacology, and the question is the first line of treatment in acute anterior uvitis. Now, this question is pretty simple, and in acute anterior uveitis, the main first thing you will give is your mediatric and cycloplegic drugs. Main objective of your using of mediatrics is to comfort and rest the eye. So the correct option of this question is your topical mediatrics. All other things are also used, but the first line of treatment is your topical mediatrics. Now, moving on to our third question, that is from anatomy, and the question is which is the strongest orbital wall? To understand this, we have to know the normal anatomy of the orbital wall. Now, the orbit has four walls, not five like in the options. The apex is not the orbital wall. Rest of them lateral medial floor and your roof is your orbital wall. Now, to understand which one will be the strongest, we have to know the anatomy of each of the walls. The lateral wall is made up of your greater wing of sphenoid and zygomatic bone, and it is the thickest of all the walls. The medial wall is made up of your maxillary, lacrimal, ethmoid, and sphenoid bone. The floor is made up of your zygomatic, maxillary, and palatine bones. And the roof is made of your lesser wing of sphenoid and orbital plate of the frontal bone. So, as I said, that lateral wall is the thickest of all the bones, hence it will be the strongest, and the answer is your A, lateral wall. Now, moving on to our next question, question number 4, that is from pathology. The question is a young male of 22 years present with gradual decrease of visual acuity in both eyes and change of refraction. On examination with an retinoscope, there was high astigmatism. Give likely diagnosis. Now, in this question, look for the keywords, and the keywords are your decrease of visual acuity and change of refractive error. So, you know that cornea is responsible for the refraction, and it is a powerful refracting lens which has the refractive power of around 43 diopters. So there is something wrong with the cornea, and that's why there is change of your refractive error and the decrease, hence the decrease of your visual acuity. First, option A, which is keratoconus, and it can't be because the patient is of 22 years old. Keratoconus occurs at birth, so this option is wrong. The option B is keratoconus, and it all the presentations actually meet the criteria of your keratoconus: the age, the change of refractive error, and the your high astigmatism. So keratoconus may be the likely option, but let's look at other options as well. The option C is your megalocornea, which is similar to your keratoglobulus, and it is also diagnosed at birth, except that in megalocornea there is increased corneal diameter with absence of your corneal thinning. Now, moving on to the question 5, that is also from pathology, that the question is: a young boy presented in emergency with watering and photophobia in right eye. Which test is appropriate? Now, first of all, we have to identify what is the disease with the patient. He came with watering and photophobia in the right eye, meaning only the one eye, and there is watering and photophobia, which are the signs of your keratitis. So the patient is suffering from keratitis. With this in mind, we will look at the options. Now the first option is your Schirmer test, and Schirmer test determines whether a person's eye produces enough tears to keep the eye healthy or moist. And this test is not of our use because we want to confirm the keratitis and we have to find out the cause of it. So this test is wrong and we should not have to do this test. So the option A is incorrect. Now the option B is your tear breakup time, which is basically used for the evaporative dry eye disease, and in this case there is no need to do such test, so this option is wrong as well. Moving on to the option C, that is your rose bengal staining, and this stain is used to uh, uh, identify the damage to the eyes, the damaged conjunctiva, and damaged corneal cells. Now the fourth option is your applanation tonometry, and it can detect keratitis, but it is not most appropriate test as it can causes your corneal abrasion. Fifth option, that is also option E, fluorescent staining, and fluorescent staining use fluorescent, that is a orange dye, and it uses blue light to detect foreign bodies in the eye, and this is the most appropriate test. It is rapid test and it identifies the organism. That's it for today's video. I will post more BCQS video, but only if you subscribe, so hit that subscribe button. Thanks for watching.